In this morning's Hot Trends report, the medical community has been developing drug-free ways to treat pains. That includes implants based on the pacemaker technology. Joining me are Maria Teese, she's an implant recipient, and Dr. Douglas Keene of Advanced Pain Management. First of all, thank you so much to both of you for coming out on this really important topic. First of all, let's talk about this. This is a neurostimulator, and it's based on like a pacemaker, the technology?
That is correct.
How does it work?
Essentially, there are two small wires that are placed within the spinal canal in the epidural space. Most people have heard of epidural for a labor pain, to deal with the pain of labor, that sort of thing. And an epidural refers to a space, and we can manipulate that space and insert small electrodes or wires and place them over the areas of the spinal cord that correspond to the patient's discomfort.
That's interesting, and we're seeing some graphics that demonstrate the kind of surgery you do. Now, what kind of pain is it used for, and how long are these neurotransmitters good for?
Good question. These devices are best for people who have neuropathic pain. So people who have, say, sciatica and they have a disc herniation, they have surgery, and unfortunately they still have lots of arm or leg pain. And we can insert these devices, and they apply a small electrical impulse to the spinal cord and can help to decrease the pain significantly. As far as duration, most of the devices on the market currently are rechargeable, and they're good for about 10 years. And although we do have some devices that are what we call primary cell battery or are not rechargeable.
So, Maria, you've been using one for, you said, almost 6 years. You've been using this technology anyway.
Yes.
What did you use it for, and how did you feel when you first started using the neurotransmitter?
I have a disease called complex regional pain syndrome, and that caused severe pain in my foot and my hand. Something as simple as putting a sock on, I was unable to do. Following this treatment, I was able to go back to my life. I show and ride horses, I can take care of my farm, but I can also put a sock and shoe on. I can put a glove on my hand.
Now, as we're looking, you brought the actual, and thank you very much, Dr. Keene, for bringing the actual device. This has to be, you've got to be proactive, though. Do you need to somehow push a button when you feel that pain might come on?
No, I keep it on all the time.
I
So
see.
it's on all the time. I do feel a sensation in my hand or arm, but it's not something that you're aware of all the time. You get used to it, and it alleviates the pain. So.
It takes away the pain. So basically, you might feel like a tingling or a
Correct.
numbness as opposed to that sharp pain.
Yeah, it's just a tingling.
And doctor, does insurance cover this?
It does. Yes, for the appropriate indications, it is a covered benefit in most insurance plans.
How long did the surgery take for you, and when did you begin to feel relief, Maria?
Relief was instant. The moment
Wow.
it was turned on, I had relief. It was instant.
And the surgery is, it's invasive in that you are going into the spinal cord, correct?
Not the spinal cord itself, but in the spinal canal.
The canal, I'm sorry, I should
yes.
have been clear.
So yes, it is invasive in that sense. However, it's a two-part surgery. We start with a trial where we just place what are called percutaneous leads, meaning through the skin. We place 2 leads in the skin and make sure people are getting stimulation in the operating room. And we tape those leads in place, and they kind of walk around with a little leash and a remote control and see, does it work for them? And then they come back the next week and we pull the leads out in the office, and if it works very well, we can plant the whole thing under the skin, and they can talk to it through a remote control and recharge it in the whole 9 yards.
And just hearing it from you, Maria, it's changed your life.
It has changed my life dramatically. Pain controlled every aspect of my life, and this gave me my whole life back.
Gave you your whole life back. Maria Teese and Dr. Keene of Advanced Pain Management, thank you so much for coming in and talking about the neurotransmitter, and to know that we offer this technology in the Madison area. That's great. For more information on the neurotransmitter, please go to our web channel, NBC15.com. We have all that information and a link to Advanced Pain Management right there on News Links.